Hello, I'm Dimity Clancy. Welcome to A Current Affair. First tonight, are we cruising towards another COVID Christmas? It's becoming a real fear after the arrival of more than 800 positive passengers on board the Majestic Princess in Sydney this morning. Infectious diseases expert Dr Paul Griffin joins me now. Dr Griffin, thank you for coming on the program. Ironically, you've just walked out of a major conference in Melbourne centred around vaccines. I imagine there must have been a lot of talk about the Majestic Princess today.
Look, we haven't covered it specifically in the conference, but there have been a lot of discussions amongst our colleagues, and it's clear it's a very significant event, but probably mostly reflects what's happening in the community all across the country at the moment. It's very clear there's quite a bit of COVID in the community. We're seeing lots of transmission and even a number of people in hospital, and that's certainly increased in the last few weeks, and people need to understand that it's a risk again significantly at the moment and take some steps to reduce that risk.
Talking about reducing that risk, those who have tested positive don't have to isolate under New South Wales COVID rules. I mean, is this just asking for trouble? Are we at a point where we can rely on people to do the right thing, or could this be another Ruby Princess super spreader event?
I think things have changed just so much since the Ruby Princess. We obviously have high levels of vaccination in the community, not enough, particularly with boosters, but we do have a population that's high levels of vaccination. We do have therapies, for example, a lot of people previously exposed, so discussions around hybrid immunity are relevant now. And of course, lots of COVID elsewhere in the community. So while it is a significant event, we do need to take steps to address it, particularly in terms of reducing the risk of those passengers passing COVID on, particularly if they're travelling to other parts of the country. We need to not overreact to this situation and understand that really we should be looking at reducing that risk across the board, because COVID is just simply everywhere in our country right now.
Today, a whole new load of passengers boarded the Majestic Princess. Apparently the ship has had a deep clean. Would you be thinking twice about getting on board?
Look, I certainly would, and I'd encourage people to consider their risk in terms of going to what is quite a high-risk environment for transmission to occur. If I was severely immunocompromised, elderly, or had lots of medical problems, I certainly wouldn't be going on a cruise like that at the moment. And if I made the choice to do so, I'd make sure I was up to date with my vaccines, and I'd employ social distancing and mask wearing, ventilation where possible as measures to try and reduce my risk. But, once again, this is what's happening in the community everywhere at the moment, everywhere where people are in close proximity to large numbers of people, in poorly ventilated environments, there's a risk of very significant numbers of transmission, and that's why we need to take steps to reduce that everywhere so that we get this current wave under control as quickly as possible.
Dr Griffin, even before this, case numbers and hospitalisations have been spiking. There are new variants a lot of us haven't even heard about. Are we heading for a COVID Christmas?
It's clear we're going to have a significant wave of transmission that's already commenced, and there are a number of new subvariants that are contributing that, XBB, BQ1 and a number of others, for example. It's probably also the fact that our immunity is waning as our uptake of boosters is very poor, and so we need to do more to address that risk at the moment. And I think if we get the response right, if we see mask wearing increase, if we see people staying home when they're unwell, if we see people get their boosters, then hopefully this wave will be fairly short-lived and maybe even over by Christmas. I think if we remain complacent and don't take any steps to reduce this wave, then we could still see COVID impact our holiday season.
What's the latest on vaccines coming out of the conference today, especially in relation to these new variants?
Look, it's clear that the vaccines we've used in this country have worked tremendously well. mRNA has been an exceptional technology in terms of COVID vaccines and is likely to be applied to a number of other pathogens in the near future and is going to continue to remain vital in terms of the response to COVID. So it's an exciting time, and we have to recognise there's going to be a number of additional iterations of vaccines for COVID, but the most important thing is whichever vaccine is available, people need to get, because none of them are going to help us if we don't have high rates of uptake, particularly of boosters like we're seeing at the moment.
Dr Griffin, you're based in Queensland, where the state government has lifted its COVID warning level to amber now, which means, masks on public transport, hospitals and aged care facilities. Should other states be following suit?
I think this is one of the biggest challenges we've faced during the pandemic is states have such different rules. It becomes very confusing for people to understand what they need to do and the rationale for it. I personally would have liked to have seen masks just be something that continued to be encouraged, a sustained behavioural change, because taking them off and putting them back on so quickly is something that's a bit hard for people to grasp and get back into those good habits. So, mask wearing is a really important tool for reducing the risk of COVID and will remain so for the foreseeable future.
Dr Griffin, thank you for your time. Infectious diseases expert Dr Paul Griffin joining me there.